Hey, what procedures does a plastic surgeon say are procedures that he would never get himself? I think this is important. This is interesting that a plastic surgeon says that, hey, I would never get these procedures done on myself.
So I know an older guy that got his eyes done, because he had like droopy eyelids.
Yeah.
And he has his eyes are now he looks completely different. His eyes are opened up like the first time in 20 years. So I don't think it's that. I mean, are we talking about like common ones that we would all know, or like some really obscure ones?
A lot of these are common.
Lipo.
So
Lipo seems pretty pedestrian.
Probably have figured out by now. I'm calling my plastic surgeon, board certified brother.
He might be in surgery. Did you talk to him earlier?
No, this is just a cold call.
Dude, it's late in the day. His first surgery is like at 7 o'clock in the morning.
Yeah, it's 8:30.
He's probably like installing the second boob right now.
He might not be available.
What are you doing calling him now? This is a terrible time.
We always call him.
Please leave a message.
Yeah, that's weird. He's not
We
picking up.
call him early, and he's like, I'm scrubbing up for surgery. What do you want?
I'm thinking he's sleeping.
Yeah, let me
Is he
try
on
one more
vacation
time.
or something?
No, he's not. I spoke to him last night.
What's he doing sleeping at 8:30?
Yeah, he'll pick up. His rule of two is he'll pick up the second time.
Probably has the nurse walking over to his phone in the corner of the OR.
Unless he's juggling some 500cc implants right now. I guess we're not getting my bro on the phone. I guess he's not available.
So while I've often seen these as dramatic surgeries, I've always heard like a rhinoplasty was like really.
Ooh.
You know what? Be careful on a rhinoplasty.
Guess what? Number one is nose related, but let me tell you what this is. So this plastic surgeon, a board certified plastic surgeon, Dr. Sean McNally, did an interview with the New York Post, and he says, make sure you do your research, vet your provider, and these are plastic surgery procedures he does not recommend. So he's speaking out on popular procedures that he would not recommend, including a popular facial surgery that can cause premature aging and others that just have too many risks. So he'd never get these. Number one is a liquid nose job.
What is that?
I don't know. That's why I'm trying to call my brother. Well, I have a description.
A liquid nose job.
Yeah, so-called liquid nose jobs are non-surgical options for rhinoplasty that involve injecting fillers into the nose.
Yeah.
I mean, when you think about liquid nose job, when I think of liquid nose job, just like, squirting Dr. Pepper up in that schnoz or something. All right.
So, is it to make it fuller?
Yeah. So they're typically used to make small adjustments to symmetry, bumps, or downturned tips. As the result of this particular procedure, it could last up to 18 months. But Dr. McNally said that the seemingly minor procedure can actually lead to serious complications that are tough to repair. Incidental injection into tiny blood vessels of the nose can clog the blood vessels, kill the skin. Oh, man, then you end up with necrosis. And like your whole nose is being eaten away.
I looked at this before and after. I mean, this pretty young woman.
Yeah.
But like the first picture, her nose has like a
it
hook.
narrows out, or it thins out, and it's not a very symmetrical nose. And then
she gets her nose symmetrical.
Yeah, she says they injected fillers, and it kind of filled out the nose, but the doctor is saying that there can be complications of this. So number one is he's saying do not get a liquid nose job. He said this is an extremely hard problem to reconstruct, and even in the best of hands, it'll never quite look and function the same. Yeah, that's the last thing you want. The next one, number two, a procedure he would never get done. Eye depigmentation. I don't want people touching my eyes.
What?
Listen, unless it's like, cataract surgery time when I'm like 80, then obviously,
So people are permanent coloring in the eyes?
So let's say you've got brown eyes. You wish you had blue eyes. There's something called keratopigmentation, where pigments are injected into the eyes via laser to change your eye color.
Yeah, this isn't like a LASIK procedure or a cataract procedure or
No.
something like that.
This is just like a cosmetic deal. I mean, why don't you just put in those colored contact lenses?
Yeah.
He says this procedure is one of the highest complication rate cosmetic surgeries of all. And one of the possible complications is blindness.
Duh.
That's
Well,
great.
yeah.
Yeah, that's what we needed from that guy.
He said, just stick with colored contact lenses and don't do the eye depigmentation deal.
I think that's what Fester just said.
Yeah. The next thing is number 3. He would never have, is it buccal fat removal? Buccal?
I think it's buccal.
Buccal?
I don't know.
Buccal, whatever, is a procedure during which fat pads are removed from the cheeks to create a slimmer appearance and often accentuates the cheekbones, the jawline,
Look at this before and after. Here, this young woman has like a triple chin. Like there's like the bump of her chin.
Oh, it's like the chin is totally connected to her neck. It's just like it's like a 45-degree angle.
But then after the procedure, and she doesn't look like a obese woman. She just has that face.
Now she's sculpted.
Yeah, with that jowl underneath. Yeah. Wow.
Yeah, the jowl is gone.
Why? What's the problem with this?
Yeah, the problem with this, and listen, jaw lines, man, that's a whole thing. If you all the videos that pop up on, what's the perfect chiseled jawline, and that's a whole vanity thing these days. But the buccal or buccal fat removal, where these fat pads are removed, I guess it became very, very popular and hot back in 2021 and 2022. Oh, Chrissy Teigen. Michelle, you hate her, don't you?
Well, I don't love her.
Why do you dislike Chrissy Teigen?
She's mean. I think she's a mean girl.
Yeah, that's right. I remember you said that. Yeah, so she got it done. Remember her whole... Remember, because you used to call her like chubby cheeks or chipmunk cheeks.
I didn't call her that, but that's what she was known on the internet.
Chipmunk cheeks or whatever? So she had it done, and it changed her like... You couldn't recognize... She's a whole different looking woman.
Yeah.
Because she had this done. But the doc says that the removal of the buccal or buccal fat is typically completed to help thin out the lower face of the patients. While it can certainly accomplish this, and it has a good risk profile, it can also have the effect of prematurely aging people by decreasing the cheek volume, allowing the remaining volume of the cheek to shift down. So it could prematurely age you, make you look older. So you might get some short-term benefit, but you might be kicking yourself in the butt long-term by going with that procedure. But there are a lot of people that are like, I want it now. I want it now. I'm living for the moment. I don't care about, 10 minutes down the road. I don't care about 10 years down the road. No. You got those people. All right, then number 4 and 5, these are the last ones. Number 4 and 5, Kybella and cool sculpting.
I've heard of cool sculpting.
Yeah, so have I. He's not a fan of either of these risky treatments aimed at fat. Kybella, an injection, does so with dioxycloic acid, which breaks down fat, and then you've got cool sculpting, which freezes the fat, causing it to die. He says I'd avoid Kybella since it doesn't work as well as you'd hope, and you might as well put that money toward the liposuction. You'll probably end up wanting after having it done. And then I guess on top of that, the scar tissue from Kybella makes liposuction more difficult. Also, doesn't think that cool sculpting is as effective as people might think it is.
Well, you know who had a problem with that?
Who's that?
Linda Evangelista.
Oh, that's right.
Remember?
Ooh. Yeah, actress Linda Evangelista.
No, model.
Model, rather. That's right. I remember that. Well, she did some acting, too, I think.
Okay.
I think she was on an episode of Knots Landing.
I don't know.
I don't know either.
That was Dynasty.
Yeah, one of
but
those.
she was severely, I don't want to say deformed, but it produced a protrusion on her backside from where the clamp, I think, where they freeze, from what I understand.
She ended up looking like Chet in Weird Science. The giant blob, So those are the 5 procedures that this plastic surgeon would recommend against. Thanks for watching the video. Hope you liked it. Go ahead and click, share, subscribe, all this stuff.